Hello, Mrs. Pennington. My name is Abby, and I'm going to be your admitting nurse today. I'm just going to be asking you a few questions just to get to the bottom of whatever you're feeling today. So, I heard that you came here with complaints of muscle weakness, and can you tell me a little bit more about that?
Yeah, lately, I fell a few days ago. Lately, I've been feeling really weak and having a lot of pain in my legs, and kind of feeling a little unsteady on my feet.
So you fell, and when was this? Was this today?
It was a few days ago, but I've been feeling the pain and the weakness for quite some time now.
Okay. Yeah, we'll do a more thorough assessment of you later on just to see what's happening. And can I ask you about any medications that you take at home?
Yeah, I take Dilantin. I had a stroke a couple years ago, so they give me that for seizures that happened after my stroke. I figured if I take more, that Dilantin will be more effective.
Well, Mrs. Pennington, Dilantin is a pretty aggressive medication, and we'll talk about this later on with the doctor when we meet with him, but when you take prescribed medications, you should only take the dosage that is written in the prescription, no less and no more. That way you get the most therapeutic effect, okay? And we'll discuss this more with your doctor later.
Okay.
So how is it like at home for you, Mrs. Pennington? Do you live alone? Do you live with any relatives? What is it like for you there?
I live alone. I'm retired. I don't really do much. I eat 2 meals a day. I know it's not really very nutritious, but it's really hard to get to the supermarket. It's so far away. I don't have a car, and I don't drive anymore. But there's a Quick Mart downtown. It's much more convenient.
Mm-hmm.
Yeah.
And the Quick Mart, do they have anything, any produce? What do they offer there?
Oh, they have all kinds of stuff. They have vegetables, but I don't really buy them because they don't always look very good. They're always kind of wilted, and some of them are kind of bruised. But they have a lot of quick meals. You can put them in the microwave and for a couple of minutes, and you have a meal.
Mm-hmm. So you usually just eat ready-to-eat prepared foods?
Yeah, and I sort of ration them out. That way they last a long time.
Okay. And why do you ration them out? Is there any particular reason why you do that?
Yeah, I'm trying to save money. You know, I'm retired, so I have a fixed income. I don't really have a lot of money to work with.
Mm-hmm. I understand. And also, how much time do you spend outside, or how long?
Oh, I don't know how long, but I try to stay away from going outside as much as possible. I don't want to get sunburned. It's too hot.
Mm-hmm. Okay. And lastly, do you have any family history that you would like to tell me, or you'd like the doctor to know about?
Yeah, my father had chronic kidney disease.
Mm-hmm.
That much I do know. I don't know about anyone else. I don't think anyone else had any other diseases.
Okay. Thank you for answering all the questions, Mrs. Pennington. Another nurse will be in to take your physical assessment, and we'll get back to you with the doctor, okay?
Okay. Dr. Eze, Lucy Pennington's x-rays just came back, and I was just wondering if we could go over them.
Oh, take a seat. Yeah, I would like that.
So, the radiologist sent these back.
Okay. And we can see some looser lines here, the pseudo-fractures. Those
Okay.
are typical of osteomalacia.
So that's what she has.
Yes. And the second x-ray shows the bowing of the bones due to weakness and decreased calcium deposits in the bones. So Yeah, ergocalciferol will be the best thing to prescribe for this patient.
Thank you, Dr. Eze.
Hello, my name is Dr. Eze. How are you doing today?
I'm not so good today.
Why not?
Well, I'm in pain. Have you figured out what's wrong with me?
Yes, we have, it turns out you have osteomalacia. Do you know what that is?
I don't. How did I get that?
So osteomalacia is a disease when there's an imbalance of vitamin D and phosphorus in your bone matrix, and this makes your bone very weak, and it's an adult version of rickets. And your diet is also one of the factors, and you need to improve your vitamin D, increase more vitamin D and phosphorus in your diet. So we prescribed you ergocalciferol. This helps create homeostasis in your calcium and phosphorus levels in the bone. A nurse will be here to talk to you more about it and its administration.
Okay.
Hello. How are you today?
I'm okay. I could be better.
Okay. Well, I'm Caitlin. I'm going to be your nurse today. Let me take
Hi,
care of
Caitlin.
you. Can you give me your name and date of birth?
Lucy Pennington, May 12th, 1945.
Okay, perfect. Now I see that you have been recently diagnosed with osteomalacia. Do you know anything about that?
Isn't that kind of like osteoporosis?
While they do share similarities, osteoporosis and osteomalacia are very different. For example, osteoporosis is decreased bone mass from lack of calcium, which manifests as like osteopenia, which is bone loss, and it's when the body doesn't make new bone as quickly as it reabsorbs old bone. It also results in bone fractures, and your levels, I know that your doctor took some blood levels from you the other day before you were diagnosed. For levels with osteoporosis in particular, phosphate levels are normal, parathyroid levels are also normal, along with the alkaline phosphatase levels. In osteomalacia, all of these levels are mainly low, so when you have osteomalacia, you have low levels of phosphate, you have low levels of parathyroid, and you also have high alkaline phosphatase levels. Osteomalacia is also demineralized bone from a lack of vitamin D, which manifests mostly as pseudofractures or looser zones. I know that your doctor took some x-rays and they showed some looser zones on your pelvic area. That's really common for osteomalacia, those are transverse, translucent bands seen in the x-rays. They usually happen on both sides. So they're really common in people with osteomalacia. I know that when the nurse first took your initial assessment, you stated that you had some troubles finding food, is that right?
Yeah.
And you also reported to the nurse that when you do eat meals, they're not very nutritious.
Well, I try to save money. You know, I don't make a lot of money. I'm retired. I have a fixed income, and I try to make the meals stretch. So I put water in my milk. It makes it last longer.
Okay. And also another risk factor for developing osteomalacia is poor nutrition. Because of the lack of vitamin D in your diet, that could have contributed to your development of osteomalacia. I know you also reported that you don't like going out in the sun very much. Maybe it irritates your skin.
It's too hot.
It's too hot.
Yeah.
I understand. But that also contributes to your diagnosis of osteomalacia because of the vitamin D deficiency. You're not getting the vitamin D from the sun, so that decreases your levels even more. So what you can do to prevent that is maybe use sunscreen, of course, but go outside even for a little bit, maybe 10-20 minutes a day. Just find some time to go outside. Maybe take a walk if you can. You know, your doctor prescribed you a medicine. So the National Institute of Health recommends that you get 15 micrograms of vitamin D daily.
that corresponds with your age. So being above 70, you have to take those 15 micrograms, which is also 1,800 international units. And I know that when you first came in, you were complaining of lower extremity pain, and you had a waddling gait and unsteady gait, and that was really troubling you, which intensified at night and when you were doing things. So when you were actively participating in a physical activity, those symptoms worsened. That is also a symptom of osteomalacia. Do you have any questions for me at all?
No, I think you did a very good job of explaining everything.
Okay. Well, I'll be back a little later to check in on you, okay?
Okay. The doctor's prescribed a new medication for you, so I'm just here to tell you a little bit about it.
Okay.
The name is calciferol, and it's a vitamin. And right now, the doctor's prescribed 1,000 international daily units by mouth. And what that does is it increases your vitamin D levels. And you may need some blood work done just for like the first 2 weeks periodically to check your calcium and phosphorus levels. I'll come in and deliver it to you later. Some side effects are just like some weakness. You can experience nausea, constipation. That's pretty much it. So do you have any other questions?
Do the side effects go away after a while?
Sometimes they may not even occur, and they may decrease the longer you take it. And also you just have to remember to follow your prescription. So don't take any more, don't take any less, just follow the dose that the doctor's prescribed.
Okay, that sounds good.
Hi, my name is Sim.
Hello, my name is Dr. Eze.
You are being discharged today, so I just wanted to give you some information about resources that will help you find adequate nutrition so you can eat better meals. And I brought you this pamphlet. It's information about the Elderly Nutrition Program. It'll give you lots of information about programs such as Meals on Wheels, local churches, food shelves, where you can, just to name a few. Just remember to take your medication as prescribed. Don't take more or less. And don't stop taking it just because you feel better. And also some foods that you can eat that are also high in vitamin D are milk, yogurt, sardines, tuna, salmon, cheese, and orange juice. Dr. Eze, do you have anything else you would like to add?
Yeah, just like she said, just keep with the regimen for the medicine. And I'd like to see you back in about 2 weeks. You can schedule an appointment with the nurse so I can see your levels of calcium and your vitamin D and phosphorus and see if the medication regimen is working for you.
Do you have any questions?
No, I don't have any questions. Thank you so much.
You're welcome. We hope that you start to feel better, and we'll see you in 2 weeks.
Okay, thank you.